Okay, this is the 6th session in polytrauma station. Okay, and always remember that we are discussing pathology stations. Okay, so the examiner now will jump after he asked about the definition of DIC, what are the functions of the platelets, and how platelets are formed from bone marrow. So now the examiner will jump to something else. The examiner will ask you about why this patient in this station here, in this scenario, why he has bleeding tendency. Why has bleeding tendency? Why this patient has bleeding tendency? Okay. And actually, I want to give you a piece of advice here. If the examiner jumped, if you do not know these questions, and you do not, and if you did not attend these lectures, which will be a bad idea actually, and you are asked a question that is not related to the previous question, you want to look at the copy of the scenario that will be given to you by the examiner. Okay, because if you do not look at the copy, or you do not attend this session, or you know already the question that you are expecting that question, it will be asked, you will not answer this question, although it is very easy. Actually, if you remember in the beginning of this station, in the first section, we told that this patient has hepatitis C. Okay, and with the questions you forgot already that point, but they suggest that you will put it in your mind, because you are a surgeon and you will become a great surgeon in the world, so you have to remember everything. Anyway, this patient has hepatitis C, and this is the reason that why this patient has a great tendency for bleeding. Okay, so you know that the vitamin K is produced there from the liver, and if he has hepatitis C, most probably this patient has a problem with bleeding control. So this is the first question here. In this part you will be asked another question, and this question will be what are the very late manifestations of hepatitis C? Okay, and this is or if you know the first answer, you will know the second answer. And here there is one problem. These two questions are related together, and every one of them most probably has 2 marks. Okay, and if you say that I do not remember past this question, he will tell you that the next question is related to the previous question, so you have to answer this question. And most probably in this point the question is so easy to be answered, so focus. Okay, so very late manifestations of hepatitis C, as you know, are either cirrhosis, okay, or hepatocellular carcinoma. Okay, so these are the consequences. Patient will develop after 20 years or something like that, he will develop cirrhosis, and after that hepatocellular carcinoma will develop. So this part of the station is related to each other, and these two questions has a very high mark, but they are so easy if you focus well.